Okay, today I'm going to talk about what is mind body pain. Sometimes this term, mind body, some people associate with, oh, it's all coming from my mind. The pain that I'm experiencing is coming from my mind. Let me check to see if this is recording. Okay, yeah, um, little check there, little tech check there. Okay, so what is this mind body idea as it relates to pain? So there's a lot of different theories, thoughts, perspectives on this. But one of the first pioneers of mind body theory in terms of pain was Dr. John Sarno, who wrote a book many years ago, I think in the 80s, called The Mind Body Prescription, or there's also one called Healing Back Pain. And what Dr. John Sarno, who was a rehabilitative medicine physician at Rusk Hospital in New York for many years, he came to the conclusion that a certain percentage of his patients were experiencing pain, namely back pain, was what he focused on years ago. But I think that actually started to include other pain syndromes or pain issues like fibromyalgia and neck pain, knee pain, other types of pain. So while he originally focused on back pain, he realized that a certain percentage, as I said earlier, there was a personality type that went along with people who were in chronic pain. And it seemed to be that they didn't really have anything indicative on their imaging that showed what Sarno called, um, or let me backtrack here. Sarno called a lot of the images, MRIs and CT scans and x rays, a lot of the imaging techniques, he said found normal abnormalities. And we've known this for a very, very long time that if someone has a finding on an MRI, it doesn't necessarily mean that that correlates to the pain that they're actually feeling. What it means is that they have an abnormality on their MRI, but Dr. John Sarno called these normal abnormalities. And what that means is a lot of us are just walking around with abnormalities, quote unquote, normal abnormalities when you take a picture of our back or you take a picture of our spine. And so what happens is surgeons or orthopedists look at these images and they say, you have, a disc protrusion L4, L5, or a facet problem at this level. Or so they're pointing to data that then tells people that there gives the reason for the pain in theory, but very often it's actually not the reason for their pain. And this isn't some wild idea that Sarno came up with or that I'm speaking of now. It's actually been known for a really long time that a lot of imaging is not reliable in terms of um, actually diagnosing the reason for someone's pain. So what Sarno did is he would evaluate patients and say, hey, yeah, you have back pain because of this physical issue. And he would send them to PT or send them to the appropriate um, referral. So he got a reputation as being a mind body physician, and a quack was the word that a lot of his colleagues used to describe him because they weren't willing to accept the the idea that certain percentage, not all, let's keep our critical thinking and complex nuanced thinking on board here while we have this conversation, that some of his patients had pain because they were angry or they had rage, or they had a cocktail of emotions that they had been suppressing for a very long time. And he called this tension myositis syndrome, or tension myoneuralgia syndrome was what he renamed it later. Some people colloquially, I hate that word, I can never say it right, colloquially call this too much stress, TMS, too much stress, or TMS, too much suppression. And so a lot of people, regular everyday people, will notice that their pain increases with stress, or their pain increases when they go through something stressful, or their pain increases when they're experiencing anger that hasn't been expressed. So when anger isn't expressed, it can become rage in the subconscious mind. So what Sarno did is he took a lot of some of these Freudian concepts and he made them into something that made more sense. Freud believed that people experienced chronic pain were punishing themselves. And what Sarno actually says is no, these people aren't punishing themselves. This pain is being felt as a distraction to keep them safe, meaning, and some people call TMS distraction pain. So what this means is the body creates pain from an emotional space of subconscious or conscious cocktails of negative emotions in order to distract the person from expressing these emotions. So why would you not express these emotions? Well, it depends on the personality type. So Sarno had two personality types that he talked about, which was the perfectionist and the goodist. So the perfectionist is kind of self-explanatory. It's the type B personality that wants everything to be kind of perfect and in line and in control. And those people put a lot of pressure on themselves. And the other personality type that puts a lot of pressure on themselves is something that he called the goodist, which are people who are consider themselves highly moral and ethical people. They're sort of the diplomatic types that maybe they keep the peace, and they're known for um, being good moderators, and for not losing their shit, for a better lack of a better term. So because these people don't lose their shit when they need to, and when I say lose their shit, I don't mean in an inappropriate way, but in some fashion through some kind of strategy to release emotion, then it accumulates in the subconscious and becomes expressed in the body. So when you tell somebody they potentially have a mind body syndrome or a mind body issue, they may roll their eyes and be like, yeah, whatever. But it's actually current brain science shows that people do experience something called centralized or neuroplastic pain. And so that means the central nervous system has hardwired this pain in, and there's not actually a structural issue going on. Although there may be muscle tension, deconditioning, and other things, but there's not actual physical trauma to the area. It's more of a signal that gets wired in, and the brain keeps that signal running. And often that signal is fueled by fear or guilt, shame, rage, undone emotions. And a lot of these emotions for people with perfectionism or goodism aren't acceptable or not socially acceptable emotions because they are controlled individuals. So you'll find people who have this sort of Sarno like mind body pain can sometimes fall into these categories of personality types. And so the goodist and the perfectionist can be sort of separate, or you can very often have an overlapping of both. I consider myself to have an overlapping of both of those personality characteristics. You'll see this in people who are workaholics. You'll see this in people who, again, tend to be the diplomatic types. Keep everything under control. Keep the peace. Very orderly. They don't like any sense of losing control. It may provoke anxiety. So I wanted to make an important point about Sarno as well, in that he died in 2017. I think he was in his early 90s. And if you YouTube interviews with him, you'll kind of see people asking him questions, and embedded in the question sometimes is mind versus body, or mind over body, or whatever. Like they're separate things, and he will clearly and adamantly state they are the same thing. They are the same thing. They are always the same thing. There is never a difference between the mind and the body when you're talking about pain. They're intertwined inextricably. So what does this mean? I've heard patients say, and many people think, well, are you saying I did this to myself? That this pain is a result of something I did to myself? And no, not really. It's just a result of a coping mechanism for many people. And culturally, it's not appropriate to go around expressing rage or anger or frustration all the time. And I think what else comes into play is trauma. And what psychologists now use this term, trauma with a big T or trauma with a little t. And trauma with a big T are usually like accidents, big accidents, car accidents, major illnesses, things like that, physical or sexual abuse. Trauma with a little t can be your everyday life, being stuck in traffic, arguments with your partner or your spouse, just the general, I'm just going to come out and say it, beating down that many people experience in their everyday lives just to get by, just to work, make ends meet, dealing with bosses, dealing with, even if you don't have a boss, like I don't have a boss, I'm self-employed. And that's can be a stressor in itself, because you are completely responsible for the whole business. Okay, I'm getting on a little bit of a tangent here, but the point is we all experience some level of trauma, big T, little t. If you don't like the word trauma, find another word. Some people get really cringe at that word. I get it. I'm a little bit like that. I cringe a little bit at the word trauma, and I cringe a little bit at the word wounding, because I like to that's just my issue. I'm one of those types that refuses to. I don't like to use victim language. That's my own little issue. And it may not be victim language, it's just my thing. So anyway, the point is that you may be experiencing pain, and maybe you've experienced this pain for many years. Maybe you've experienced this pain for 6 months. Maybe you've experienced this pain for 6 weeks. And sure, there could be something structurally wrong. Could be some kind of trauma. There could be some kind of metabolic issue that's affecting your nerves, or like high blood sugar or something else, or some kind of other damage. But there's a certain percentage of you where that damage has now been healed. but you're still feeling the pain. You're guarding. You are walking around the world gingerly, trying to not pick things up too fast or too heavy, trying to move in a way that doesn't hurt yourself or out of fear. And I think it's worth exploring this idea of the mind body, or if you want to not use that term, neuroplastic pain, if you want something more sciencey, or central sensitization is another word, or centralization of pain, central nervous system wiring, whatever word you want to use, is all of the same thing. It just depends on your perspective and what words you're willing to accept. So in my practice, I consider all of those things. I consider, is this trauma? Is this damage to the back? Is this damage to the knee? Is this damage to the shoulder, to the neck? Is it inflamed? How long has it been going on? What do we need to do to decrease inflammation? What nutrients need to be met? What physical activity needs to be done to condition the body into a better state? But I also consider, is this pain central? Has this pain been hardwired in? Is there no longer damage, but this pain has been hardwired by the central nervous system, almost like a habit? And what can we do to treat that situation? So there are a lot of different strategies. Some include a lot of it includes therapy, certain types of therapy. Some people can journal in a certain way. Some people learn to calm down their nervous system through meditation, certain types of meditation. There's a vast array of tools, and it really depends on the person, what kind of situation they're in. Not everybody responds to certain types of meditation. So we use a different type of meditation. So I really just want to come on here and talk a little bit about that, and that I think that looking at your pain through the lens of multiple angles and getting functional again, and looking at it through a functional rehabilitative pair of eyes, and using any tool, the appropriate tools in the box to address it. Because I also know, just from 15 years of practice, that many people assume that surgery is the last ditch and that's what's going to heal them, and that's what's going to cure their pain. And I will tell you right now that sometimes it does, but most of the time it doesn't. And you actually end up needing multiple surgeries very often, or you end up more debilitated. So it's worth exploring all your options. Acupuncture is one of those options, along with some of the other strategies that I have talked about. And for anybody curious, you can look up John Sarno. Quick and dirty is to just look him up on YouTube and get a look at a few YouTube interviews with him. There's also a film, a documentary that was made by some of his proteges. It's a couple years old, about 2 years old, but it's called All the Rage, Saved by Sarno. I highly recommend that one. John Sarno was also Howard Stern's back doctor, as well as Larry David. If you need a little street cred, there you go. Howard Stern is probably the least woo-woo person you'll meet or not meet here on the radio. But check that out. There's also some great books like Unlearn Your Pain by Howard Schubiner. That's a really good book. It's also based on Sarno's principles and any of Sarno's books. But just know, if you have questions about this method, this way of perceiving or looking at your own pain, give my office a call, 415-630-5322. Or you can shoot me an email at amy@norcalintegrativemedicine.com. And we could set up a free 20-minute consultation to just chat about the possibilities, and looking at it from all angles. So that's pretty much all I wanted to say today. I know this video is getting long, and in the age of the internet, long videos aren't exactly an acceptable format, but this is how I roll, and I have to get it all out. So there we have it. So give me a call if you want to have a chat. Otherwise, check out the books. Google John Sarno or Howard Schubiner, and have a good day. Take care.